through the Health Sherpa Marketplace. First, you're going to get an email like this. It's going to say renew your plan online. You'll click that and you'll land anywhere within this application. You want to put in your first and last name, your date of birth, sex, and your social security number. Then you can go on, add in your address. County will show up automatically. This is your permanent mailing address. Click yes. Email, phone number. If you have a P.O. box, you can click no, and it'll give you an option to put in. If it's your permanent mail, it'll give you an option to change that. You are applying for coverage. You do want to see if you're going to get a savings. If you have a spouse, you'll add it here. Most of you guys will already have this filled out with all your information, so you just want to make sure everything is up to date and complete. If you're married or not, you click yes or no. Always click that you're going to file federal taxes or else you will not be eligible, but that should be clicked out already. If you have dependents, you can add them here, just the name and birth date. We have to add everybody because this is based on household size and income. Even if they're not getting insurance, if you have a new child or a new dependent or you recently got married or anything, you want to add all that information in there. You're a U.S. citizen. Alaska, Native American, no. Decline to answer as much as possible where their options are. If it's optional, you can also skip it. This page here, foster care, no. Okay, save that. Income. Now this is the important part, okay? If you're self-employed or whatever it is, if you don't know your job's phone number, you can just put in all sevens. You want to put down your employer name. Let's say Walmart. You want to put in your income. Now, for income, if you do not make more than this and you're a single person in a single person household, and let's say last year your income was $12,900 and this year it says $12,900, if your income does not start here or go higher, you will not be able to get a subsidized plan, and it will say that you're denied or give you an extremely high price. So for the family size of one person, which is one dependent, not married, not claiming anybody, no dependents, not married, just yourself, you have to make between $13,000 to $20,000 to get a fully subsidized plan. You can make over or under, but you're going to pay more for it or just be denied. Two family, here's the income that you have to be at. So if you're at 13,500, it's okay to change it to match. If you're close, it's okay. Now, if you make more money, a lot more, let's say you make $40,000 and you put down 20, you're going to be penalized on your taxes. But if you make 21, 22, you put down 20, it's not an issue. I also recommend adding standardized deductions in, which are tax deductions that you can do with no, you don't have to prove anything or have receipts or anything. So for my clients who are married and they have a higher income, in order to bring it down to get a better rate, that's the way to do it. Here's a family of 7. 41,000 to 62,000 is where they have to be in order to get a fully subsidized plan. Typically, the plans are free. So keep that in mind. If you do have issues, that's going to be your best bet to make sure that those issues are not there. If you run into those issues, just text or call me and I can help you figure it out and get around some of the roadblocks that we go into nowadays. 13,600 a year. John Doe is a single person. He has no deductions, and that is his income, correct? We're going to skip all this stuff here unless it pertains to you, but 99% of the people it does not. And I would rather you not mess with that if it hasn't been clicked already, because this will already be filled out from when you applied for this year. Go through that. Everything's good. It's all good. You can just kind of run through all this stuff. Agree. Make sure you agree on everything. Now they're going to ask if you have had insurance in the past or if you currently have insurance. Even though you do have marketplace insurance, you can click no because they're not referencing that. They're just talking about other insurance in general. You have to add your name on there correctly. It can be no commas. It has to be your name in the signing part. And then this is all here because this is a fake person. Download eligibility form and choose marketplace plan. Then you simply go into here and choose your plan. Right now we're seeing really good plans for Alabama with Blue Cross Blue Shield. this is the plan that I would choose. It's completely free, no charge for doctor visits, no charge for drugs, and specialist visits are $10. There's no deductible, and the plan normally is $431 a month. So these are the type of plans that you'll see. Search around, look for what you want, choose the plan that you want, apply these changes, and simply enroll.